Good evening. What can you tell us about the Catholic Church's position regarding the Liverpool Care Pathway?
The Liverpool Care Pathway, now on version 12, contravenes Catholic teaching. The Church states that nutrition and hydration, even when administered by artificial means, are forms of natural care.
I see. So in Catholic teaching, food and water are not removable clinical treatments.
Even though the LCP has ostensible safeguards which may appear to protect a patient's access to fluids, the LCP guidelines contain ambiguous, discretionary terms, like in the patient's best interest or not detrimental to a patient, which means that any clinician, diagnostic team, or post-prognosis, any of the medical staff may remove that hydration tube. The dehydrating agent hyoscine is also used as an anti-nausea drug. Removing fluids reduces the effect of morphine so as muscles and internal organs dry out and die. The patient is left in agony and sedated to prevent telling anyone.
But what does the Church say about pain relief towards the end of one's life?
Catholic teaching is that opiates for pain relief must be needs-based and must not sedate anyone unnecessarily in their final hours. Pius XII in his 1957 speech to the anaesthetists said unnecessary sedation of patients is a deplorable practice repugnant to Christian sentiments and is ultimately gravely evil.
So the Liverpool Care Pathway, with its prognosis-based opiate provision, rather than needs-based pain relief, is opposed by the Church.
Yes. This can lead to unnecessary sedation and deny the patient the opportunity to die a good, pain-limited, optimally conscious, natural death surrounded by their loved ones. Continuous deep sedation which prevents this is rapidly becoming normative practice.
So Catholics are taught: 1. Do not remove fluids, and 2. Don't sedate unnecessarily by over-prescribing painkillers.
Yes, but there is a further issue. Opiates don't merely relieve pain or sedate. Trescott in his 2008 study and Gomez in 2011 revealed that this unnecessary opiate use actually accelerates death in patients not dying from cancer. This contradicts what our Bishops' Conference said on the issue in their 2004 end-of-life document, where they said morphine doesn't hasten death. Plainly and simply, the bishops got it wrong. Morphine is euthanizing non-cancer patients, and this aspect of LCP practice contravenes the fifth commandment, thou shalt not kill.
So it isn't the abuse or misuse of the LCP which is the issue, it is its mere use within its unsafe safeguards which is dangerous.
Yes. And this is further aggravated when the LCP implements irreversible end-of-life procedures after a 72-hour prognosis. That is over-prescribing morphine and removing all food and fluids. To quote a leading contributor to the Catholic Medical Quarterly, once you are on the Liverpool Care Pathway you will die, even if you weren't dying. We need to face the truth that the LCP is a form of backdoor euthanasia.
Anthony Cole, chairman of the Medical Ethics Alliance, has also expressed grave concerns on the LCP.
Yes. He argues there are hardly any circumstances where fluids should be withdrawn, that dehydration makes morphine more toxic, and the suggested doses are too large for the frail and elderly, and consciousness and self-determination are critically impaired, that there is no provision for a truly independent second opinion, and informed consent is dispensed with.
As the audit showed, where over half of those placed on the LCP were without consent from either patient or a family member.
And LCP implementation often involves very inexperienced staff.
There is also no required training for anyone using the LCP.
Plus there is no certainty of determining the imminence of death, especially in the elderly with multiple pathologies, when increasingly more often post-mortems revealing death by different causes to the presumed diagnosis. One might seem to be fighting for one's final breath, but if provided with food, fluids and basic medical care, the patient might live for further months or even years, but not if they are doomed to a doped-up dehydration on the LCP.
Dr. Cole also states difficulties will arise in this procedure from a lack of continuity in care.
Tony Cole warns us that inexperienced, untrained staff will be stopping fluids and giving powerful drugs with lethal effect.
So the LCP has safeguards which, once that 72-hour prognosis is made, do not prevent untrained medical staff removing water and administering morphine to continuous deep sedation levels.
The safeguards are not safe. What is more, relatives of LCP patients will be ill-informed, suspicious and sometimes embittered.
And for spiritual and family reasons, the ideal scenario would be one where pain is reduced but one has a fully conscious natural death to the end, living out one's final hours in dignity.
The LCP does not exclude this, but it doesn't exclude dehydrating and being put to sleep either. Finally, Dr. Cole leaves us with a devastating prediction. Palliative care itself could be discredited and it could play into the hands of proponents of euthanasia.
But some senior Catholic ethicists strongly support the Liverpool Care Pathway, don't they? Saying it conforms to Catholic teaching and that those who oppose the LCP are scaremongering and playing into the hands of the pro-euthanasia lobby.
Let me explain. The Liverpool Care Pathway is backdoor euthanasia. But Catholic ethicists, medical and charity quango professionals, clerics or Catholic commentators, even pro-life activists, are denying it is euthanasia, and dismiss every concern and seek to suppress any opposition to it.
And we have to ask why they are so hostile.
The answer is they want to protect more lives from a very imminent danger. Active euthanasia legislation being passed by Parliament. They are scared.
Please explain.
They know that if they say the LCP is euthanizing, it will look like it's a regular normative medical practice in the NHS, and thus make euthanasia easier to become law. And as the LCP is a long drawn-out form of passive euthanasia, a system aimed at reduction in pain and suffering would logically seek to introduce assisted suicide, direct active euthanasia, especially in these days of financial restrictions.
The irony. These Catholic experts wish to fight against euthanasia, and to do so they believe they must turn a blind eye to euthanasia on the LCP, to stop euthanasia being made law.
Yes, from the frying pan of the thousands euthanized on the LCP, to the fire of the hundreds of thousands euthanized through active euthanasia legislation. Yes, they are terrified of the consequences, which is why they are silent. They are afraid that trying to save the lives of the few might very well kill the many.
Which is why we have at present in this country a conspiracy of silence on the LCP. A whispering campaign against Orthodox Catholic and Christian ethicists, healthcare workers, commentators, activists, bloggers, etc. Anyone who warns the public of the dangers of the LCP is being told to shut up.
Because, like Caiaphas, the high priest of the Gospels, who said it was better for one man to die than the nation.
The utilitarian viewpoint. Losing the few to protect the many.
The argument is that it is better for a few thousand to die through use, misuse and abuse of the LCP,
than for the law to be changed to assisted suicide and active euthanasia, ultimately leading to the deaths of millions in generations to come.
Yes, this present material and formal cooperation with evil by willfully denying the gravely immoral and barbaric character of the LCP, the murder of patients and the deliberate attempts to silence those denouncing it as backdoor euthanasia,
is scandalous.
It is a nightmare redolent of the silence about the trains going to Auschwitz. Our neighbor is being dehydrated and put to sleep, and those in the public arena to provide a moral voice against euthanasia in all its forms, are not saying a word. They are letting them die and pretending they were not murdered.
So what should Catholics do?
If Catholics are to sincerely, authentically claim to be defenders of the dignity and sanctity of life, we must contact our bishops, our MPs. We must express a vociferous solidarity in our neighbor's defense against this
institutionalized genocide.
Yes, and demand changes to the LCP which guarantee that no one is given a death sentence for utilitarian, eugenic or financial motives. palliative care that guarantees needs-based provision of care and opiate provision with the absolute principle that food and water are forms of natural care and not clinical treatments, which may be withdrawn. If we deprived a pet animal of water and let it die of thirst, we could be prosecuted and thrown into prison. Yet every 4 minutes we remove the hydration tubes from one of our neighbors until they die of thirst, not from their illness. And we call it dying. With dignity, it's evil. And the evil is increasing because good men and women are staying silent and allowing this evil to happen. It can't go on. It must be stopped. Now, we have to realize we are at the brink of the nightmare of a new era of eugenics and euthanasia, and we have a final chance to speak out to save patient lives, and in the process save our lives, and our consciences, maybe our souls too. Because who knows? There may come a time when there may be nobody left who will speak out for me.
But some euthanasia activists would claim their motives are humane. They would be astonished at your describing it as murder.
There is no such thing as dying with dignity, but there is living with dignity until one's final breath. And it is something we would wish for everyone to receive, a good death.
1 in 6 of our annual dead die on the LCP.
Please help stop this now, before it's too late.